All right, good afternoon. So today we're going to talk about preventing shoulder injuries for both the injured and uninjured population, which is a very interesting topic because there's a lot of considerations to take into account with dealing with injury with the shoulder. So the best way to prevent injury, of course, is, or to prevent re-injury is to prevent the initial injury. So as we go over, I have no disclosures. So when doing a literature review, these are some of the criteria we're looking for. So shoulder prevention, shoulder screening, neuromuscular and strength. And it's very interesting because if you look back just a little bit over a decade ago to the last 5 years, the information has increased greatly as there's become more of an epidemic of shoulder injuries, especially with sports and sports participation. So we're looking at adolescents. So we'll classify adolescents as people pretty much below the age of 18 or your high school or below athletes, where most of these injuries are occurring because that's the largest population playing these sports. So there are several studies that actually do show that you can reduce the incidence of shoulder injury associated with the risk factors for participating in a specific training program. So you can do training programs and protocols that will help athletes become stronger through the ranges of motion that are at risk with overhead activities. So it's not just baseball, we're talking about volleyball, tennis, we're talking about all javelin throwing, all athletes. So when doing that, the first thing we have to consider when we create a program for preventing injury is, what are the risk of injury based on the sport? So what ranges of motion are we at risk, or are we putting our athletes through, and are they at risk for injury? And then who's at risk? So what populations are being injured, and what are the factors involving that injury? So we have to create a hierarchy of modifiable changes. We're looking at what can we change about the athlete as far as technique, range of motion, strength, concentrically and eccentrically, and then how can we quantify these? So we're looking at upper extremity performance testing and then screening tools potentially. From there on, we can create our return to play protocols. So when you're looking at that, you're looking at maturity as one of the biggest risk factors. So we're talking anatomical versus biological. So with anatomical, we're actually talking about the actual development age of the athlete we're dealing with, right? So we're looking at their 10, 12-year-old male, female, etc. The biological is more so as far as where they are in their actual development. So kids mature differently. You want to understand what rate the athlete is maturing. So it's a unique balance between the two as where they are age-wise and where they are function and performance-wise. So in looking at a link between injuries, you can see that the volume is a very important aspect. And here's one study that showed that, 8 months a year, 8 months per year increase the odds of injury for a throwing athlete. So these athletes not only were throwing for a majority of the year, but they're also throwing through muscular fatigue because it's about performance as opposed to long-term athletic development. And that's one of the priorities we have to be focused on for our athletes, because we may have them in their adolescent stages, but if they do have dreams or pursuits of going on to continue playing, whether at a collegiate or whether at a professional level or even recreationally, we have to be considerate of how much wear and tear they're putting on their body when we also condition them. So then the mechanics. So this is a study looking at volleyball athletes and working on changing their technique. So we have the traditional technique versus an alternative technique. And with those, they found that you can slightly change the trajectory and you can actually reduce the forces on the shoulder while increasing the velocity of their performance, so a spiking technique. So if we're looking at our athletes, let's assess what they have to go through. So looking at the sport, range of motion, if we're going through the forces we've talked about before, what we're worried about based on throwing per se. This is just an example of how much forces and muscle activation we're getting based on the phase of throwing. When we look at your training status, also important. Has our athlete been conditioned before? Have they just been throwing? Have they been resistance training? Had they been resistance training appropriately? Their capacity is also important as well. A lot of times we talk about we're strength training our athletes, but the most important question I have for people that are in charge of athletes is your athlete contracting appropriately? So your athlete performs the range of motion as desired, but a lot of times athletes or their trainers never ask, where do you feel this? how does it feel to you? You're not getting any feedback. So while they're performing the drill and it looks like it's correct, if their mechanics are incorrect or they're not engaging where you need them to engage, you're doing them a disservice because you're reinforcing negative mechanical patterns and biomechanical patterns, which will become neuromuscular patterns, which is their throwing technique throughout the course of their career. And then the volume. So very important is their seasonal workload. So we're talking about practice and a game. A lot of times you think, oh, let's go pitch count. Well, if we're going pitch count or how many throws, how many attempts we have in a game, you're ignoring a volume of their work. It's the prep leading up in the off season and during the season. So you want to have an understanding with the coaching staff of how much work the athlete's actually going through. So when you design a strength and conditioning protocol to prevent injury, you want to take into account the amount of volume they have year round. And it should be a healthy discussion with your coach. So, lastly, per season, per year. So also if you have normative data, which is also going to help the coach out, you want to know per season, how many throwing attempts are we doing? And over the course of a year, you want to have an idea of how much your athlete is actually throwing, because they'll play in multiple sports, multiple seasons, multiple teams. So when we look at performance testing protocol, this is just another study that looked over several different tests to see if there's any kind of correlation they can come out with or any kind of predictive data they could find. And the closed kinetic chain upper extremity stability test and then the unilateral seated shot put were the two that really had a good positive correlation to performance and or prediction of injury. Now, with that being said, there's not enough normative data to dictate, say, your athlete should be here, they should be there. But part of the responsibility is we need to be testing them constantly to see their progression off-season, in-season. Do they lose strength, range of motion? Do they change mechanics? So those are things you want to consider when we do protocols. And this is another data basically of observational study looking at these two tests to say that they do differentiate by population. Males performing better than females, athletes performing better than non-athletes, and then throwing athletes, specifically baseball, doing better in your upper quarter Y balance test. So if you're studying throwing mechanics and we're looking to create a protocol, we have to understand the mechanics from the ground up. So foot position, elbow flexion, all these different factors are all factors of throwing for most athletes. So when considering a protocol, you want to address each one of these to make sure your athlete is functioning and firing correctly. So one way we can do that is focusing on teaching mechanics. So you'll see that there's studies that show that the most valuable time to teach mechanics is, of course, early in their career, but we're a performance-based society. So we're more concerned whether that kid is hitting the strike zone, throwing it as hard as he can, as opposed to long-term development. Are their mechanics right? So that's part of our job as the people responsible for their health and well-being to consider that. If you look at their kinematics over the course of their careers in different age groups, you can see we subdivided them, the study subdivided them into 10 to 15, 15 to 20, 17 to 23, and then 20 to 29. So when you see the kinetic variables were considered for throwing and the forces that they dealt with throwing, you can kind of see that it increases as they get older, which is expected. They're getting stronger, they're maturing, they're getting longer, which is going to help increase their performance, but also increase their stress on the body. And with that, few differences in positional and temporal parameters across all subjects, meaning that it wasn't more of an issue of their techniques as they got older, it's the forces they're able to apply through the technique, meaning that if the kid is throwing fairly well or exceptionally well at a young age, it's not so much of the mechanics that he's experiencing, it's the stresses he's putting on his body through the mechanic. So you're not going to be able to adapt and change it that much. It's a performance sport. So again, responsible mechanics. So consideration, training status, age of the athlete, what they've been doing, volume of workload, mechanics, range of motion, what's available to them versus what's desired based on the sport. There is normative data on the ranges of motion in sport. So that's something we can actually measure and say where are they versus where they should be. Secondary prevention, so once the athlete has an injury, we also want to consider their training status. There's limited testing and no certain performance testing you can do with that athlete to say this is when they're ready to play. When they're injured with a shoulder injury and they're an overhead or throwing athlete, we have to be very careful and progress them in a whole different manner because the likelihood of re-injury with the forces that they've incurred. So we use a regressive model of their mechanics. So we start from the ground up. And then again, looking at range of motion is still available versus desired. And then the volume, same thing, regress model. With a healthy athlete, you can give them a similar workload, and if you've been tracking their data and the coach has been tracking the data, you can actually see and say, you know, they should be doing this many throws per season, this many throws in the off season, and we can examine their progress and create more of a normative data, which can be useful for studies in the future. With a injured athlete, all that goes out the window. Okay, so contact versus non-contact. Is there anything you can do to address that? There are some things you can do. We're not going to hit them while they're throwing. We do understand that while they will be throwing, we can add some perturbation to them to enhance their stability through the range of motion as they're throwing. So this is an example, which I believe I have a figure of later, that of an exercise of 90-90 shoulder tubing isolation with a flex bar. Okay, essentially your athlete will be in that 90-90 position and they'll actually be using the flex bar to stimulate or to simulate that kind of disturbance when you're throwing. So, quantifying risk, we create an athletic profile considering maturity, body composition. We look at the demands of the sport, the experience and the skill, training age of the athlete. We screen them, and again, screening is just a tool to see if there's any imbalances in the individual, and then we have to discover what they are. Remember, all screens are not diagnostic. They are just trying to show you what the athlete's exhibiting, and then you have to figure out why they're exhibiting X, Y, and Z, and then creating a warm-up protocol for your athletes. So this long and complicated page is an example of different protocols and program design guidelines. I have a much simplified version for you if you would like a copy of it. Essentially going over 3-week, 10-week program 3 times a week has been shown, and it's a general protocol, meaning it's not specific to throwing at all. They didn't do any weighted throwing, they didn't do any tubing, it's just general specific strength and conditioning. Could increase the throwing velocity by 5.6%. And they show positive gains in the lifts they were doing. And there actually is no difference yet discovered between general, special, and specific training protocols. How many of us know what general, special, and specific training protocols are? Okay, so general strength conditioning protocols is just basic resistance training exercises. As we go into your let's say specific protocol, now you're going to address specific ranges of motion. The classic example you can use is where your athlete may release point, where the release point is for the throw, or even simpler, the jumping point for an athlete. If your athlete plays an explosive sport like basketball, the jump point is higher, so you don't want to train them from a deep squat when it comes to getting close to season, because they're not going to be able to use that strength when they need it. So specific, you go into a more specific range of motion. Special, you're emulating the actual sport activity. Good? Okay. So another consideration is what other kind of programs may be useful. So on this page, the most important data we're looking at is the long toss program. And specifically considering that long toss programs, where they may be effective is more of in our adolescent population. Once you reach about the collegiate level, it's actually shown that it's not so much beneficial to our collegiate athletes and may alter their mechanics. So that's something you want to consider with athletes that are of the now adult level doing long toss mechanics. Okay, so simplified version of data here. Simple, going from general to specific to special. We can see resistance training protocols. So a general protocol and a specific protocol may include medicine ball toss, resistance training, long tossing for adolescent population. The thrower's 10, and again, it kind of repeats there. 7 to 9-year-olds. Now, that seems like it's a lot of information, a lot of data, a lot of exercises for them, but it's all fairly simple. Medicine ball, dumbbell squats, Romanian deadlifts. So very simple. You're looking at total body workout, and you're going to do this 2 times per week. Young population. The concern with them, of course, will not be doing as much as they can or max performance. 10 to 12-year-old, we get a little bit more extensive, 2 to 3 times per week, doing multiple sets. So we've increased our sets, and the rep range stays relatively the same. And now we can look at some examples of special resistance training. So now this is a quarterback going through a special training for the throwing motion for them. So they have a first step drill with resistance. So just working on the footwork, like we mentioned, throwing mechanics start at the feet. And then we add a first step loading drill with elastic tubing. Again, adding a second component to the basic footwork. Single leg stability on the pad for a squat drill. We add the perturbation with the 90-90. Seated hourglass, which is just a thoracic training drill. You're working on thoracic mobility. And then the pretzel thoracic rotation, again emphasizing specifically with the quarterback's range of motion. So when you see the quarterback mobility, they're actually going to be in a position here doing their thoracic mobility. So reinforcing the actual mechanic that they're going to set up themselves to throw. So none of these are actually the full loading and follow through yet. This is all just prep, working on preventing injury for our athletes and enhancing performance. Again, this goes into a little bit more special. It goes into using a baseball bat to work with techniques, strengthening the rotator cuff and strengthening the flexors and extensors, which have also been shown to reduce forces and stress on the rotator cuff and help prevent injury. And another example, the same protocol we went over earlier, just a little bit more expanded out. Okay, so important things to consider and what you want to focus on with your athletes is mechanics from the ground up. As everyone has mentioned with scapular stabilization, include scapular stabilization in the program and making sure you get feedback that your athletes are actually understanding what they're doing and are engaging where they should be engaging. A simple, where are you feeling this, how does it feel, can give you enough feedback to let them know. Because they may be doing this and they say, I don't feel anything. So what do you do from there? So you want to make sure you can find a way to communicate to let them know where they should be feeling it and if they are engaging where they should be engaging or if they're compensating. And then core engagement also will help prevent injury, so there's always an element of that as well. And then you can use all 3 types of training, general, specific, and special, based on the time of season. General from the off season to special in season. All right, any questions? Yes.
Doing his thoracic exercises, and you were talking about how keeping them up here. Now, are you going to have them do both, say they're a righty quarterback, are you doing both righty and lefty to keep them balanced?
Good question. I say yes. I'm always in favor of that. We tend to, when an athlete is, whether they're injured or whether they're in a performance sport, we tend to isolate one side and really work on the mechanics, just one side. But remember, you need that co-contraction, that counter-contraction to perform the sport activity. So you definitely want to make sure they're fairly balanced and have full mobility on both sides. It's not only going to help them in sport, but also it's a rewarding pattern to prevent injury.
Actually, I have one more question.
Yes.
When you were talking about the volume of throwing, was that study based on pitchers or was that on any throwing athlete? Because I deal with middle school students as well, and one of my middle school students plays both the middle school team and the Little League team, and he says that his coaches, talk to one another and make sure that they're not going over throwing, but the student reported to me that he pitched 2 innings, but then went to catcher and then went to first base.
Yes, so that's a very important question, because when you talk about volume of throws, usually people are only considering the pitching, but it's overall volume of throws. So you're looking at the totality of throws they'll do in a game and per position, because sometimes, especially with Little League, they say if you move them out of pitching, then it's okay, they're throwing in the outfield or they're playing second base, and they won't count the volume. But we want overall total volume of work, and the overall intensity may vary, but you want to know how many throws is the athlete doing per week or per game or per practice. That's very important data to have, because it allows us to get normative data to when we analyze and assess perhaps rate of injury with the amount of work or total volume the athlete's been doing at all positions in all sports. Yes.
That's the difference with softball pitchers. You get a more favorable underhand motion, so it's not like count as many of those.
Yes, so slightly different with the softball. Yes, you would still want to consider how much volume of throwing they're doing, because you still want to get some normative data for the position, but there's slightly less stress involved. Well, not slightly, there is less stress involved with that underhand release. But you still want to have that data to see how much work they're doing. All right, thank you very much.